Okay, welcome to another episode of this podcast. Today I have with me Dr. Bret Contreras. Bret, how are you doing today?
I don't think I'll ever feel comfortable being called doctor.
Oh, really?
I just, I don't know. That's an American thing where call me doctor. In New Zealand, I tried to call my professor doctor, and they're all like, "No, call me John."
Yeah, I know
But yeah,
quite a few professors as well feel that way, that I don't like to be called professor or doctor. Just call me
some
my
are
first name.
adamant about it. They're like, "That's Dr. Contreras," but no, not me.
Okay, let's just stick to Bret then.
Well, you won't see me changing my social media to Dr. Bret Contreras or anything.
Okay, so how does it feel to finally be done with the PhD?
Oh God, it's so nice to be done. I've been at it for 4 years, and just a lot goes into it. So yeah, I'm very excited to finally have that out of the way.
Nice. Well, once again, congratulations.
Thank you.
Okay, before we start, could you give us a brief introduction about yourself and your current work, what you do?
Okay, so I used to be a high school math teacher. But I was spending all my time reading about strength training. Funny story, I had a professor who said, "Bret, I turned in a project," and she said, "This is the best project I've received in 13 years of being a professor. I'm sure you're a great math teacher, but you need to leave. You need to pursue your passion, and you need to go into exercise." So that's what got the wheels turning, and I opened up my own gym. I've been personal training since I was 20, and I'm 39 now. So for 19 years, I've been a personal trainer. For like probably 15 years, I've been a CSCS. Just recently got my PhD in sports science, biomechanics, and now I juggle a lot of things. So I've got my garage. I have a four-car garage gym that I converted into garage that I converted into a gym. I call that the Glute Lab, and I've got a group of like 10 girls that train with me, 10 females, and I call them the Glute Squad, and I train them twice a week. And so and then I do seminars every month where I take 16 people for the day and we do practical stuff all day. So I always make sure to be training lots of people. And I have my Strong by Bret program too, which we have got already 300 members. So I'm working with tons of clients online and in real life and in my seminars. And the practical aspect of things, you have to do that. If you just read research, you become too esoteric. You're not grounded in the practical side of things. But then I also have my research review, and I publish research. Last year, I published 12 studies. I was on 12 different studies. So that's a big part of my life. I big fan of the literature and in sports science and trying to further our knowledge and trying to conduct experiments. And I collaborate with really intelligent colleagues of mine who I'm so thankful to have as friends. So, and then it's all kind of tied together in my blog where I try to write a couple articles a week and uh, and then I'm all over social media as well. So
Excellent. So, in other words, you have your hands full.
I juggle a lot of things, but I think it's all manageable because I used to train people all day long, and it's you finish the day, you're wiped out. You don't want to read. You don't want to blog. You're too exhausted. So I do just the right amount of everything to where it's still exciting and fun.
Excellent. And you also have a nickname, the Glute Guy. So that's perfect for today's topic because we're going to talk about some glute training. And first question I want to ask you is, could you explain what the function is of the glute muscles?
Okay, so most people will just say the glutes are responsible for hip extension. Some people will name three different actions. They'll say hip extension, hip external rotation, and hip abduction. But most people forget posterior pelvic tilt. So the glutes do four main things. They do hip extension, hip abduction, hip external rotation, and posterior pelvic tilt. But hip extension and posterior pelvic tilt are kind of the same thing in a way. Because if you think of the hip, say here's the hip socket and here's the head of the femur. If you move the femur this way, it's hip extension. But if you move the pelvis this way, it's posterior pelvic tilt. But if you're just zoomed in here, the same thing's happening, you know? You've got either the femur moving into hip extension or you've got the pelvis spinning on the femur. It's a similar thing. So hip extension, or hip hyperextension, I should say, hip hyperextension and posterior pelvic tilt are kind of the same thing. You're just making sure that the full hip extension is realized. And then hip abduction can be carried out in, flexed or frontal, like frontal plane or transverse plane. You can be bent over or standing straight up. That's moving the leg out to the side. And then there's hip external rotation. So in sports you have a wide variety of things that you end up doing. So like, this is why it's so important to have strong glutes. When you cut from side to side, you think, well, that's hip abduction. But you're actually flexed, and when you move to the side, you extend and abduct at the same time. When you swing like, say, a baseball bat or a tennis racket or something, you will be flexed and you're rotating, but you're also extending the hip at the same time. So you'll start out flexed and then you finish off more extended. So hip extension lays the base for almost everything. Hip extension provides the foundation for sprinting, jumping, cutting side to side, twisting, striking, throwing. So hip extension is so important. So strong glutes are very, very important in sports. And I can't say enough about them. I mean, every coach and athlete knows, you need strong, well-functioning glutes to succeed in sports.
So which sport would you say is the sport that it's most important to have strong glutes, if you could choose one sport?
Well, I like American football because it's kind of, you need to be fast, but you also need to be strong. But you've got to push athletes forward. You have to push the opponents forward. You have to sprint linearly. You've got to cut side to side. You've got to jump. There's just so many. It's if you're a quarterback, you have to throw. Even kicking, the planted leg stabilizes. So there's just that. I like American football because it represents all ends of the force velocity curve. You have to be forceful and fast. But powerlifting, Olympic weightlifting, sprinting, track and field, and then most ground sports though you need strong glutes. So so important in most sports. Even like swimmers use their glutes, but it just to varying degrees and varying joint actions and varying speeds. So you kind of have to tailor the training towards the sport.
Excellent. Before we get into the training aspect of this podcast, could you explain health-wise why it's important to have strong glutes?
Well, so I won't delve into the science of pain because pain is very complex. You have to look into the biopsychosocial model. So biomechanics is one aspect of pain science, but it is a very important aspect in strength and conditioning, where you're doing high force, high velocity movements. So the glutes kind of, if you look at like a muscular anatomy chart with the skeleton and the muscles, and you look at the glutes, they're the centerpiece. They also, like 70 to 85% of the fibers attached to fascia. You've got attachment points along the pelvis and the sacrum and to the greater trochanter. But when you actually look at when you go to a cadaver lab, there's a lot of attachments to fascia. So it has a lot of reach across the body, through the thoracolumbar fascia. I mean, even the gluteus maximus attaches to the some of the anal sphincter muscles. So when you, even with like incontinence and things like that, it functions. And then and then through the IT band, which travels all the way down into the to the tibia. So you've got transfer all the way up to the lats down to the tibia from the glutes. And so, um, but sometimes that can sound esoteric. You can act like the glutes do everything. But I will tell you, strong glutes can kind of pull rearward on the femur so it centrates better inside the hip socket. So a lot of people get hip pain, especially anterior hip pain. When they start using their glutes better, some of that pain can go away. Sometimes, not always. Depends on why they're getting pain. Could just be their hip anatomy. But the glutes can help with that. The glutes also can help the knee track better, like say from landing and things like that. Strong glutes work as abductors and external rotators to keep your knees out so your knees don't cave in. So that can help prevent from landing. You can have ACL injuries the more knee valgus you are. So it can prevent ACL injuries, but also from patellofemoral pain. When you have strong hips, you use them more. When you have strong quads and weak hips, you'll use your quads for everything. The more you use your quads, the more the more forces that you're putting on the patellofemoral joints and the regions and all the tibia, the femur, the patella, the underside of the patella, all these areas that are prone to experiencing discomfort and pain. So, and then it also can help prevent, hamstring injuries and any of the synergists, hamstrings, adductors, erectors, because you don't overuse those. You're going to use glutes. So, and then also low back pain. The glutes, the way if you look at the sacrum is a kind of a triangle, and the glutes it's like 70% of the force of the glutes transfer directly across the SI joint. And then also it just, if you have strong glutes, you use them more. I think a lot of this is motor control. You got to pattern correctly, but you might not resort to as much spinal flexion and extension. If you have stronger glutes, you might use less spinal range of motion and more hip range of motion if your glutes are strong throughout a full range of motion. So I think those are the major ones. I'm sure I could think of more reasons why the glutes are important, but they just help the body function better.
Excellent. Okay, so let's dive into the training questions. Some people say that you don't specifically need to train the glutes if you are doing exercises like the squats and, for example, RDLs. What's your take on that, and which exercises shows the most glute activation?
So this is a funny question because it always baffles me. Do you ever see someone doing a curl and someone's like, just do chin-ups? Or someone doing a tricep extension, someone's like, just bench press. Mm-hmm. Even if someone's doing a leg extension, you don't see people going, just squat. Don't do leg curls, just deadlift. It's the weirdest thing. Like, don't do lateral raises, you idiot. Just do military presses. For some reason, I see this with glutes only. You see these women doing different, unique glute exercises, and the men come on and get pissed and go, just squat. And I think it is so stupid because, first of all, don't even consider science. I mean, I can name off the top 10 best bikini Olympians, the women, and I can tell you how they train. They have videos, and I can go down the list and tell you how Ashley Kaltwasser and all the different. I could just name them off and say I've seen their videos, and I've trained several. I've trained 3 of them, and I know the way they train. They do variety. None of them just squat, and a lot of them are squatting like, they'll squat like 95 pounds. They're not super strong in the squats, and these girls have the nicest butts in the world. And you ask them how they got them, and they'll always say, I like the hip thrust. I like the cable donkey kicks. I like back extensions. I like this. I love doing these. They all do variety. But second of all, like squats work more of the lower fibers. They don't work the upper fibers that well. There's 2 main subdivisions. There's the upper gluteus maximus and the lower gluteus maximus, but also having well-developed glutes also entails having the gluteus medius developed as well, because that forms kind of the upper outer region. So you would want to do variety. You would want to do what I said earlier. The glutes are responsible for hip extension, hip abduction, hip external rotation, posterior pelvic tilt. So you want to do a wide variety of exercises, and you want to do ones like even hip abduction. We do exercise in the frontal plane, hip abduction, and transverse plane. So like the seated hip abduction machine, that's fine to do, or you can just put bands around your knees from a seated position, do seated hip abductions, or you can be standing, doing cable standing hip abductions, or ankle weight standing hip abductions, or you can do lateral band walks with an upright stance. Those add extra volume for the upper glutes, and let's face it, those don't beat you up. Deadlifts you can't do 7 days a week hard. But you can do those bands all the time. And I've got some case studies. If you go to my test, I'm not just a science geek. Because yes, I publish research on the glutes, but you go to my testimonials page, bretcontreras.com/testimonials, and you will see like 200 of them. You'll see probably 10 of the most amazing glute transformations you've ever seen. I mean, some of them look fake. And I know what these girls are doing. They're doing variety. They're doing a wide variety of exercises. And the lateral band work that they're doing really helps add more volume, but you can do that frequently. It doesn't beat you up. You don't wake up going, oh, God, I can hardly get out of bed from all those lateral band walks. It's like I call it penalty-free volume. It doesn't beat you up, so you can do it frequently. And I had a client named Erin. I wrote a blog post on her, but she just stopped doing weights. Like, I didn't tell her to do this. She did this on her own. She stopped doing weights and started doing bands 7 days a week. She'd do 10 minutes to 60-minute workouts. So some days she'd do a whole hour, some days 10 minutes, but she would do it 7 days a week. And she won the overall. She won her first bikini competition, including the overall, took home the sword, and she was the best. It was this crazy transformation. I have her before and after. So I think that is very inefficient to just do squats and RDLs. I think you should do hip thrusts and barbell hip thrusts, band hip thrusts, double band hip thrusts, where you have a band around your knees and a band around your hips. You should do high rep, low rep, medium rep, hit all the rep ranges. You should do different types of squats, different types of deadlifts, different types of hip thrusts, different types of lateral band exercises. You should do some single leg exercise like lunges, Bulgarian split squats, step ups. You should do some extra posterior chain stuff like back extensions and reverse hypers and pull throughs and kettlebell swings. And there's so many good exercises to do. So you want to be getting stronger on some of them, but you also want to be employing a lot of variety, and also just some of them you don't try to get stronger and you just go for the feel and quality over quantity. But yeah, I think if I had to recommend one exercise for the masses, I would say it's the hip thrust.
It's so great that you say that, because I work with a lot of bikini competitors, and some of them are doing the squat, doing the RDL, but they have underdeveloped glutes. So we started doing exactly what you're recommending now, that we did exercises that doesn't tax the system a lot, and we did it more frequently. For example, some band work at the end of some of the upper body workouts or the lower body works, and we did variations with some heavy sessions and some lighter sessions just to increase the volume. And I have to say, I saw some incredible results with my clients when I started doing this. Like immediately they started seeing improvements in their glutes.
Yep, preaching to the choir.
Yeah.
I've had 2 or 3. Well, yeah, my client Molly and my client Allie, both of them grew 2 inches around their hips, 2 inches on their glutes in a 2 to 3 week period, and it was because they came to me and they weren't pushing it nearly as hard as they could on their hip thrusts, and I started giving them I'd give them like pyramids sets with the hip thrust. So they do like maybe a set of 10, a set of 8, a set of 6, and then maybe a set of 15 to 20. But I'd have them use a lot more weight, and each time I'd increase the loading And some of them, both of those girls they were getting accused of getting butt implants
Yeah.
because it was like such rapid growth. It's funny because I've talked to some scientists about this. You can't put on 2 inches of muscle mass that quickly, so it's got to be a lot of edema or cell swelling or whatever. But it's not like that goes back to normal. It's not like they lose that. So I think over time maybe it goes from more swelling and then maybe it fills in with muscle. It's hard to understand the exact science of it, but I just know that some girls respond very well to hip thrusts. Not all of them do. I always say, you know, no exercise is worth doing if it consistently causes pain or injury. So I don't have every girl squat. I don't have every girl deadlift. Well, actually, all my clients do squat and deadlift and hip thrust, but they're all healthy women. But if I trained, say I had 50 clients, I'm sure there'd be a few who didn't do each of the main exercises. You need to fit the exercises to the individual, but I think if I had to pick one, again, it would be the hip thrust.
Okay, great. So, if you could give a general recommendation, let's say you have a client that's mainly focused on the aesthetics. She just wanna improve the looks of her glutes or him. Um, what would be your general recommendations in regard to training frequency and how you would use different rep ranges during the week?
Okay, so this is a tough question to tackle because you're asking about frequency and exercise selection, but the things that affect frequency are your effort and loading and the exercise selection. So when I do my seminars, I go through this very carefully, but um, exercise selection. If you do 5 sets of 5 deadlifts to close to failure, how often can you do that? I would say you can't even do that twice a week. You can only do that once a week if you do 5 sets of 5, all 5 sets close to failure. So if that's all you did for glutes, you could only do that one day a week. So it depends on and also if you do lunges and Bulgarian split squats stretch your glutes to a long muscle length. They get you very sore. Sometimes if I do 3 hard sets of lunges, the next day I can hardly sit down on the toilet. So the next day I can't train my glutes. So, but if you do exercise that train the muscles mainly at short lengths, like hip thrusts, back extensions, and all band work, because bands, they don't work you hard in the stretch, they work you hard in the shortened muscle lengths, and then they're good at developing a lot of metabolic stress. You feel a good burn, you get a pump when you use bands, but they don't get you very sore the next day. So if you just did band hip thrusts and band seated hip abductions and lateral band walks, you could do that probably 5 days a week, no problem. So exercise selection and effort and load matter. So I use the shotgun approach. You know, I don't know right now. Could you just do hip thrusts 3 days a week and maximize your glute growth? Maybe, but I don't know that right now. I like to think of Brad Schoenfeld's model where he says there's 3 primary mechanisms: mechanical tension, metabolic stress, muscle damage. So how can I get a lot of mechanical tension? Well, we're going to try and use progressive overload on our hip thrusts, our squats, and our deadlifts. How do I get a lot of metabolic stress? We're going to add in some high rep stuff, some bands. We're going to add in some sets of 30 back extensions done in a glute dominant fashion, or frog pumps I've been doing lately. They kind of look funny, but you just do them on the floor. They're like glute bridges, but with your feet together. Band work, band hip thrust, double band hip thrust, and then you get a ton of metabolic stress. You get the burn. I think that enhances muscle hypertrophy, enhances glute growth when you add in that stuff, just as you found. And then I also want to add in some muscle damage, but not too much because I don't want to interfere with frequency. So I'm not doing 4 sets of lunges, 4 sets of Bulgarian split squats. It's more like doing 1 to 2 sets, but not always with progressive overload because I want them to. They will get stronger at that, but it's not my main focus because I don't want to make them too sore. So it's like mixing. It's a tough task to mix all this stuff together without overdoing it. But that's what I like about having my glute lab. I train all these girls, and I've been writing their programs for and I pay close attention to how they feel. And some months I write a program, and I see on their Friday session their eyes are glazed over and they look like zombies. It's like I'm too aggressive, and so in general I would say 3 days a week, 3 to 4 days a week is best for glute growth. You can do 7 days a week if all you did was bands and exercise that don't beat you up too much, and you don't go to failure on everything, and you're not so obsessed with progressive overload. You could also see glute growth probably training 1 day a week if you just hit it super hard on, say you did squats, deadlifts, and hip thrusts really hard, and then some like a cable standing hip abduction. You hit the upper, the lower, and if you utilize progressive overload, you could see glute growth. But can you see maximum glute growth that way? I don't think so. I think you need 3 days a week to optimize glute growth. But I also think that it depends on the client, because I'm thinking of my client Sammy right now. If I train her too often, she gets weaker. She does best training hard 2 days a week. And then I think of some of my other clients who can handle more volume, but like that same client, Sammy, if I gave her 4 sets of things, she'd get weaker. She was my strongest client ever, but she could not do a lot of volume and frequency. So it depends on the individual. We've all trained those freaks that just are very different than the others. So at the end of the day, I can tell you averages and give broad general recommendations, but the listener needs to tweak their own program to fit them.
Excellent. Let's get back to the exercise hip thrust, because I know you published a study last year where you looked at where you compared the American hip thrust, the barbell hip thrust, and the band hip thrust. What was the reason behind doing this study? What were you looking for, and what did you actually find?
So I'll just preface this. So the barbell hip thrust is the first variation I came up with. And then I called it the American hip thrust because I didn't know what else to call it. I didn't want to call it like you hinge high. So the reason I thought of this is that the client I told you about earlier, Molly, who grew 2 inches on her glutes, she's training with me now still, but this was years back. She couldn't push hip thrust hard because they hurt her low back. And I'd be trying to tell her, like, don't hyperextend at the top, don't hyperextend. But she's in extension and anterior pelvic tilt. It always looked like she's sticking her butt out, but she's really looks like she's in good amount of anterior tilt just normally. So when she would do hip thrusts, I'd see her, and I'd try to work with her lumbopelvic complex mechanics, lumbopelvic hip complex mechanics, and then I'm like, I gotta think of a better way. So I had her slide her back up higher on the bench. So instead of hinging from like where the bench is touching in like mid scapula level, it's more like mid back, like I don't know exactly where, if it would be lower thoracic vertebrae or whatever, but she scoots higher up on the bench, and then you don't go down and touch the plates to the floor. You reverse in midair, but when you come up, it's a posterior pelvic tilting thing where you see the pelvis come up. So then the ribs stay down, and you get this real flat torso. And so she couldn't do hip thrust really hard until I thought of that. And when I thought of that, I gave it to her, and she's like, "Oh my God, there's no pain. This feels so good on my low back." But she finally started being able to push her glutes really hard. So I remember she was only doing 115 pounds for 3 sets of 15. The next week she got 135 pounds for 3 sets of 15, or the next session she got 135 for 3 sets of 15. Then the next session she got 155 for 3 sets of 15. And then the next session she got 175 for 3 sets of 15. And I'm like, she's going up 20 pounds every session, because it was the first time she could push them to their full potential. And she just responded like crazy. So anyway, so the American hip thrust works well for people who sometimes have low back issues when they do regular hip thrusts. And then the band variation I started doing later on when I realized, God, these bands work great. But I started using my hip thruster machine, which allows you to do them with the band attachments. You can also do them at a gym. If you can do them in a power rack or like putting dumbbells down. But the band hip thrusts, some people who never feel their glutes, like I had a training partner, Charles Staley, he never felt his glutes much with hip thrusts. He started doing band hip thrusts, and he's like, oh my God, I can't believe how good these work. And I even have a video of him I put on YouTube where he's like, I've never felt my glutes working so hard in my entire life than one set of these band hip thrusts. I never felt them much with the barbell, but here they're burning like crazy. They're all pumped. So here's what the study showed. The study, but I'm gonna go a step further after I tell you what the study showed. I'm gonna tell you what the average is. The barbell hip thrust was best for the glutes, but uh, one thing about the American hip thrust was what that was nice is it used a little less quad and a little more hamstring than the barbell hip thrust. So some people who feel their quads overworking, they might benefit from trying the American hip thrust. And I was wondering if maybe the peaks got higher with the bands, but that wasn't the case. Mean and peak was higher with barbell. I know the barbell hip thrust was highest with lower glutes, but I actually think the American hip thrust might have had higher upper glute, but I don't think it was significant. But anyway, here's the take home with what I took up for the study. We had 13 subjects, and there were a couple of subjects that got their highest activation from band hip thrusts. There were a handful that got their highest activation from American hip thrusts, and there were a handful who got their highest from barbell hip thrusts. So when you average out the means, yeah, that's great. But when you look at the actual distribution, and you saw that 2 of the 13 got their highest with bands, well, that jives with my experience as a personal trainer. That occasionally you get the client there that are like, I feel bands working so much better, and some people try the American hip thrust version. They're like, I don't like this at all, and some people love it. So it's always good as a personal trainer to have a big arsenal, and you know, you want to have a big arsenal so you can experiment, but ultimately you have to tailor the program design to the client, to the individual, to the athlete.
Excellent. Okay, Bret, that was really awesome. Thank you so much for taking the time to doing this podcast. Could you tell us the name of your website and also the new page that you launched?
So my website's bretcontreras.com, but if you don't remember my name, you can just type in the glute guy onto Google and my website comes up. So it's Bret Contreras. There's one T in Bret, bretcontreras.com. And from there, that's kind of the hub. So if you want to follow me on social media like Facebook, Twitter, YouTube, Instagram, there are links from the website. There's also a link to my Strong by Bret program, which I just launched. That's training for women, and that's the same program that I give my glute squad, my regular clients. But you get videos sent to you explaining the workouts, explaining form, and you can do that same program. I also have a research review that I do with my partner Chris Beardsley, and I'm really proud of that. So if you're into research and you like, we summarize 50 journal articles every single month, and we go through 80 different journals in strength and conditioning, biomechanics, sports medicine, physiology, anatomy. We go through all of it. We pick out what we feel are the 50 most relevant studies for the average personal trainer or physical therapist or strength coach or even lifter. So yeah, it's all accessible through bretcontreras.com.
Excellent. Okay, Bret, thank you so much again for taking the time, and have a nice day.
Have a nice day too. Thanks for having me on.
Thank you.